You know, there's a particular sound that can give any horse owner a bit of a jolt, a heart murmur.
Mm-hmm.
Imagine your vet's doing a routine checkup, everything seems fine, and then they mention it in your horse.
Right.
It definitely sounds alarming, doesn't it? But what's really quite eye-opening is how often these murmurs aren't actually a big problem.
Exactly. Especially in older horses or athletic ones, sometimes it's just
Yeah.
there,
Yeah.
an incidental finding.
Precisely. So today we're going to dive deep into equine mitral regurgitation, or, just MR for short.
Great topic. Very common.
Yeah, it seems so. And it's this condition that can range, like you said, from totally harmless, just something the vet notes down, to a really serious health concern.
It's a wide spectrum.
So our mission today is to help you get a handle on that journey. From hearing that first, maybe worrying sound, to really understanding what it means for the horse.
How we find it, what we do.
Exactly. How vets diagnose it, the treatment options, and crucially, what the future might hold for that horse. So you walk away feeling, well, properly informed.
Sounds like a plan.
Okay, so let's unpack this then. To really get started, what exactly is mitral regurgitation in a horse? Like, what's physically happening inside their heart?
Right, okay. So mitral regurgitation. It happens when the mitral valve, think of it as a one-way door between the heart's left atrium and left ventricle. It fails to close completely.
Okay, the door doesn't shut tight.
Exactly. And this happens during systole. That's the phase when the ventricles, the big pumping chambers, contract to push blood out to the body.
Right.
So instead of all the blood shooting forward into the aorta like it should, some of it leaks or flows backward from that powerful left ventricle straight back into the left atrium it just came from.
Ah, okay. Regurgitation, flowing back. Makes sense.
And that's that backward flow, that turbulence.
Yeah,
That's what creates the heart murmur we actually hear with a stethoscope.
the sound itself.
Yeah. It's specifically a systolic murmur happens during that contraction.
Yeah.
We often describe it as blowing or maybe plateau-shaped.
And where do you usually hear it best?
Typically loudest over the left side of the chest, usually around the fifth intercostal space, so off kind of right behind the horse's elbow.
Okay.
Now, here's something really important for you to grasp. We grade these murmurs, on a scale usually 1 to 6. 6 is super loud,
Right.
but this is key. The loudness doesn't always directly match up with how severe the actual leak, the regurgitation, is.
Oh, interesting. So a loud murmur doesn't automatically mean disaster.
Not necessarily.
Okay.
And conversely, a really soft murmur isn't always harmless.
Mm.
The sound intensity is just one clue.
That's a really critical point. The ear hears something, but that's just the start of the investigation, really.
Absolutely.
So you mentioned this often develops over time. It's acquired, you said. What actually causes a horse's mitral valve to start? Well, going a bit rogue.
Right. Yeah, it's generally acquired. They're not usually born with it. It develops. And the number one cause, especially as horses get older, is something called degenerative valve disease or endocardiosis.
Okay. Degenerate?
Think of it like, age-related wear and tear on the valve itself. The leaflets, the flaps of the valve, or sometimes those little stringy bits that hold them, the chordae tendineae, the heartstrings, they can thicken up or degenerate over time.
So they just don't seal properly anymore.
Exactly. They lose their perfect fit. That's the most common scenario.
Okay. What else?
Well, a much more serious, though thankfully less common, cause is inflammatory valve disease, specifically bacterial endocarditis.
Infection?
Yeah, an infection on the valve.
Mhm.
Bacteria like Streptococcus species, Actinobacillus, even E. coli can set up shop on the valve surface.
Wow.
This causes inflammation, damage, and you get these things called vegetations, basically clumps of bacteria and inflammatory material, physically blocking the valve from closing right. That's a very serious condition.
I can imagine. Sounds nasty.
It is. Then there's also chordae tendineae rupture. Those little heartstrings we mentioned.
Yeah.
They can actually snap. Sometimes it happens really suddenly, maybe during like intense exercise, or it can happen because of ongoing inflammation or degeneration.
Snap. Just like that.
Yep. And when a chorda ruptures, it often creates what we call a flail leaflet. The leaflet just flaps uselessly. It can't seal at all.
A flail leaflet. Wow, that paints a picture. Almost like a broken hinge on a door.
Pretty much.
Yeah.
And that usually leads to a very sudden and often very severe onset of mitral regurgitation. The symptoms can come on really quickly and dramatically in those cases.
Right. That makes sense. Are there any other, maybe less common reasons this might happen?
Yeah, there are a few others, though less frequent. Mitral valve prolapse,
Right.
where the leaflets kind of bulge backward into the atrium when they close.
Yeah.
That can happen, but it seems much less common in horses than it is in people.
Okay.
Sometimes if the heart chambers enlarge, for other reasons, maybe another heart condition. The ring that the valve sits in, the annulus, can get stretched out. That's annular dilatation. And that stretching can pull the leaflets apart so they don't meet properly.
Ah, so the foundation gets warped, basically.
Kind of, yeah. And very, very rarely, you might see a foal born with a congenital malformation of the valve, but that's unusual.
Got it.
But here's another interesting point for you, especially thinking about athletic horses. Sometimes we see what's called physiologic mitral regurgitation.
Physiologic, meaning normal.
Essentially, yes. In some very fit equine athletes, a tiny bit of MR can actually be a normal adaptation of the heart to intense training. And crucially, it often doesn't affect their performance one bit.
Huh. So not all leakage is bad news, especially in an athlete.
Correct. Context is everything. As for general risk factors, though, we do tend to see EMR more often in athletic breeds, definitely in older horses, and it seems more prevalent in larger horses and ponies, too.
Okay, so it seems like while that stethoscope gives you the first vital clue, you really need more advanced tools to see the full picture.
Oh, absolutely.
How does a vet actually go about confirming it? And more importantly, figuring out just how bad that leak really is. What's this gold standard you mentioned earlier actually show you?
You're spot on. Auscultation listening is step one. Hearing that typical systolic blowing murmur on the left side, grading it 1 to 6. But like I said, the grade alone isn't the whole story. It just flags it up.
Right. Just the starting point.
Exactly. So then a really thorough physical exam is crucial. We're looking for other signs that the heart might be struggling.
Like what?
Well, signs of reduced forward blood flow. Maybe the pulse in the arteries of the leg or face feels weak or thready. In more serious cases, especially if it's progressing towards congestive heart failure or CHF,
Okay.
you might see things like a distended jugular vein pulsing in the neck, or ventral edema that's swelling under the belly and chest. Sometimes respiratory signs, like a cough, or the horse seems to be working harder to breathe, especially after exercise.
Exercise intolerance too, I guess.
Definitely. Poor performance, taking longer to recover, maybe even unexplained weight loss, if it's severe and chronic. These are all potential red flags.
So lots of clues beyond just the sound.
Absolutely. But for the definitive diagnosis, and especially for assessing how severe it is, echocardiography, an ultrasound of the heart that really is the gold standard.
The heart ultrasound.
Yeah. A 2D echo lets us actually look at the heart's structures. We see the valve leaflets themselves. Are they thick? Do they prolapse? Are the chordae intact? We measure the size of the heart chambers, like the left atrium and left ventricle. Are they enlarged?
So you can see the physical changes.
Exactly. You can see if there's thickening or prolapse, or maybe even those bacterial vegetations if we suspect endocarditis.
And the Doppler part.
Ah, yes.
Okay.
Doppler echo, especially color flow Doppler, is where you get the visual proof of the leak.
You can actually see the backflow.
Yes. It shows up as a turbulent jet of color flowing backwards into the left atrium during systole. We can see how big that jet is, how far back into the atrium it reaches, and that directly helps us quantify the severity of the MR. Is it a tiny whiff or a massive flood?
Wow. Okay, that really does sound like the definitive picture then, seeing the leak in action.
It really is. That's how we move from suspicion to confirmation and assessment.
That totally clarifies why it's the gold standard. So are there other tests that you might use alongside the echo, maybe to check for other related issues?
Yeah, definitely. An electrocardiogram or ECG is really important.
Checking the heart rhythm.
Precisely.
Yeah.
It helps us detect any arrhythmias, irregular heartbeats. A big one we look for, especially if the left atrium is enlarged from chronic MR, is atrial fibrillation, or AFib. That's quite common.
Okay.
And for performance horses, an exercising ECG can be incredibly valuable.
While they're working.
Hook them up, put them on a treadmill or ridden, and see what the heart rhythm does under stress. Sometimes arrhythmias only show up during exertion, or you might identify limitations that aren't obvious at rest.
That makes a lot of sense for athletes. What about blood tests?
Good question. Blood work can be helpful too. We can measure cardiac biomarkers, like troponin I. Elevated levels can suggest heart muscle damage. And of course, general blood work, checking white cell counts, inflammatory markers. That's important if we're worried about bacterial endocarditis, to look for signs of systemic infection.
So a multi-pronged approach, really.
Yeah.
Stethoscope, exam, echo, ECG, bloods, layering all the information.
Exactly. You build the complete picture piece by piece.
Okay, so once you've built that picture, you have the diagnosis, you know how severe it is. What are the options then? What are the different paths forward for a horse with NMR? Is it always about medication or intervention?
No, absolutely not always about intervention. That's a really key point. The treatment plan depends massively on, one, the severity of the MR based on that echo, and two, whether the horse is actually showing any clinical sign.
Right, the symptoms matter a lot.
Hugely. So for asymptomatic horses, the ones with, say, mild or maybe even moderate MR on the echo, but they feel fine, perform normally, have no outward symptoms.
Yeah.
Often, no specific medical treatment is needed at all.
Really? Just leave it.
Well, not exactly leave it. The key is careful monitoring. Regular vet checks, listening to the heart, and periodic echocardiograms maybe annually for moderate cases, perhaps every couple of years for mild ones just to track things and make sure it's not getting worse.
Okay. So watch and wait, basically.
Kind of. Active surveillance. And many of these horses can continue their athletic careers perfectly safely and live a totally normal lifespan. That's a huge takeaway for owners.
That's really reassuring. A murmur doesn't automatically mean retirement or a shortened life.
Absolutely not in many cases.
Yeah.
But the picture changes if the horse is symptomatic.
Okay.
If you have moderate to severe MR and the horse is showing clinical signs, exercise intolerance, coughing, weight loss, those signs of congestive heart failure we talked about.
The edema, the jugular pulse.
Exactly. Then the goal shifts. It becomes about palliative care.
Palliative. So not curing it, but managing it.
Precisely. Improving their comfort, managing the symptoms, and trying to slow down the progression of the disease.
And what does that involve, medication-wise?
It can involve a few different classes of drugs. Diuretics are common drugs like furosemide, the brand name is often Salix. They help get rid of excess fluid buildup in the lungs and the body.
Reduce the swelling and congestion.
Yep. Then we often use ACE inhibitors drugs like enalapril or benazepril. They help relax blood vessels, which lowers blood pressure and reduces the workload on the stressed heart. Makes it easier for the heart to pump.
Okay.
Sometimes, cautiously, we might use digoxin. It can help strengthen the heart muscles contraction and also helps control heart rate if it's too fast. And if there are significant arrhythmias, like that atrial fibrillation,
Yeah.
then antiarrhythmic drugs might be necessary. Quinidine is a classic one used for AFib in horses, though managing AFib is a whole complex topic in itself.
Right.
And of course, if it's confirmed bacterial endocarditis,
Be in second.
then aggressive long-term antibiotic therapy is absolutely vital. That's a fight against the infection itself.
Makes sense. And what about exercise for these symptomatic horses?
Generally, rest or at least significantly reduced exercise is recommended. You want to minimize the strain on the already struggling heart.
Okay. So it sounds like a pretty involved management plan for the symptomatic cases. Lots of monitoring and potential medications.
It is, and regular follow-up is critical. Frequent rechecks of the murmur, heart rhythm, breathing, regular rescans with echocardiography to see if things are changing, maybe more frequently than for the asymptomatic ones.
Gotcha. What about surgery? We hear about valve replacements in people all the time. Is that ever an option for horses?
That's a common question. Surgical intervention, like actually repairing or replacing the mitral valve,
Yeah.
it's extremely advanced stuff. And honestly, it's very rarely performed in horses.
Why is that? Too risky.
Too expensive. All of the above, really. The sheer size of the animal, the complexity of the surgery, the challenges of cardiopulmonary bypass in a horse, the recovery, the cost, it all adds up. It's much more established in small animal cardiology, like dogs, but for horses, it's generally not a practical option currently.
Okay, so medical management and monitoring are really the mainstays.
They are. And a huge part of that is owner education. Owners need to know what to watch for subtle changes in breathing, coughing, exercise tolerance, recovery time. If they spot anything concerning, they need to get the horse reevaluated quickly. Their vigilance is absolutely key.
That makes perfect sense. The owner sees the horse every day. So this brings us to the big question, doesn't it? If your horse is diagnosed with MER, what does it all actually mean for their future, their long-term health, their athletic career? How do you even start to talk about prognosis?
Yeah, that's always the bottom line question, isn't it? And the prognosis for horses with MER is, well, it's highly variable. It really depends on several critical factors we've touched on.
Okay. What are the main ones?
The biggest factor is the severity determined by the echo, and whether there's significant cardiac remodeling, meaning has the heart enlarged or changed shape because of the leak.
Right.
So for mild to maybe moderate MR, where the heart size and function look pretty normal on the echo and the horse has no symptoms, the prognosis is generally excellent.
Excellent. Like normal life expectancy.
Often, yes. Many of these horses live perfectly normal lives, continue their athletic careers for years, no problem. That's the best case scenario, and thankfully it's quite common.
That's great news for many owners.
It is, however, if the horse has moderate to severe MR and the echo shows significant heart enlargement, particularly the left atrium and ventricle are getting bigger, even if they aren't showing obvious clinical signs yet,
Uh-huh.
then the prognosis shifts. It becomes more fair to guarded,
Meaning?
meaning there's a higher risk of complications down the road. They might eventually develop symptoms or arrhythmias. Their athletic career might need to be limited, or they might need retirement from high-level work eventually. Their lifespan might be somewhat shortened compared to a horse without Millar.
Okay, so the heart enlargement is a key warning sign.
It's a very important indicator of how much strain the heart is under. And then if you have a horse with severe MR that has developed clinical signs, especially signs of congestive heart failure or severe arrhythmias,
Yeah.
then unfortunately the prognosis is generally poor.
Poor, how poor?
Significantly reduced lifespan. As we mentioned, the medical management at that stage is usually palliative, focused on comfort. Once a horse starts needing treatment for CHF due to MR, sadly survival times are often measured in months. Maybe 2 to 6 months is typical, although some might go longer with intensive management. Euthanasia often becomes the kindest option when quality of life declines significantly.
Wow. So the presence of those outward clinical signs, the breathing issues, the swelling, that really is a major turning point. It sounds like a stark difference in outcome.
It absolutely is.
Yeah.
Asymptomatic versus symptomatic is a huge prognostic divide. That's why catching it early, even before symptoms start, is so important for monitoring.
Right. What else influences the outlook?
Well, how quickly the disease is progressing makes a difference. Rapid worsening seen on serial echoes, or that sudden onset like we discussed with the chordal rupture, that's generally more serious than slow, gradual changes the heart might adapt to over years.
Okay.
The development of arrhythmias is also key. Atrial fibrillation can worsen the prognosis and make management harder. And if they develop more serious ventricular arrhythmias, those carry a risk of collapse or even sudden death, which is obviously a major concern, especially for horses still being ridden or worked.
Sudden death. That's something owners need to be aware of.
Yes. Particularly with severe MR or complex arrhythmias, it's a possibility that has to be discussed, unfortunately. The risk might be low, but it's not zero. And finally, the underlying cause matters.
How so?
Degenerative MR, that age-related wear and tear, generally has a better long-term outlook than, say, bacterial endocarditis, which, even with treatment, is often fatal. Or an acute chordal rupture, which causes sudden severe failure.
Got it. So cause, severity, symptoms, progression, arrhythmias, lots of factors feeding into that final prognosis.
Exactly. It's a complex equation.
Yeah.
But if we connect this back to the bigger picture for you, the listener, while hearing the word murmur
Yeah.
could definitely be scary at first,
Yeah.
getting that early detection through regular vet checks and then getting a definitive diagnosis and severity assessment with an echocardiogram, those are absolutely crucial steps.
They really guide everything that comes next.
Precisely. They give you the information needed to make the best decisions, to understand the most likely prognosis, and to give you and your horse the clearest path forward, whatever that may be, whether it's monitoring a mild case, managing symptoms, or continuing an athletic career.
Right. It empowers the owner with knowledge.
That's the goal.
So we've really taken quite a journey today, haven't we? Through equine mitral regurgitation, starting with that sometimes unexpected sound during a checkup, all the way through understanding the different causes, how vets piece together the diagnosis using everything from their ears to ultrasound.
The whole diagnostic toolkit.
Yeah. And then looking at the management options from simple monitoring to complex medical care, and finally grappling with that really wide spectrum of prognosis.
From excellent to poor, yeah. It covers the whole range.
So for you, the listener, maybe something to think about is this. How might understanding a condition like MR, knowing its nuances, change the way you observe your own horses or horses you interact with?
Especially the older ones or the athletes.
Exactly. Maybe it prompts a deeper appreciation for those subtle signs they might show us. Or perhaps just a fresh perspective on the incredible value of thorough, regular veterinary care and diagnostics in keeping them healthy.
Will said. Early detection and understanding really are key.